These are the Mass General selection criteria for live kidney donors. These general selection criteria are specific to Mass General, though many of them are used at transplant centers across the country. All living donors must be at least 18 years old. Any non-directed donors or donors who do not have a specific kidney recipient in mind must be at least 25 years old. All donors must donate voluntarily and not feel pressured or forced into their decision. Donors should be in good overall physical and mental health, including no history of diabetes, which is the leading cause of kidney disease. Having a BMI or body mass index of 35 or less at the time of evaluation, and ideally a BMI of 32 or less by the time of donation surgery. Having no active drug or alcohol abuse or no significant history of drug or alcohol abuse. Having no significant medical conditions such as heart, lung, or liver diseases, bleeding or clotting disorders, recent cancer, though skin cancers other than melanoma are usually acceptable, but most other types of cancer will require years of remission. Being free from HIV, active hepatitis B and C, or other infections or behaviors that increase the risk of developing these infections. Having no significant psychiatric conditions requiring significant treatment or at higher risk of recurrence. Having either current or a history of kidney stones or high blood pressure will require additional testing to determine whether the donor is an acceptable candidate. Being willing to stop all forms of smoking for at least 8 weeks before donation surgery and stop any oral birth control pills and usually hormone replacement therapy for 4 weeks before and after donation surgery. For direct donation, where the donor donates their kidney directly to their intended recipient, the first item we consider is blood type. There are 4 blood types: O, A, B, and AB. Donors who are blood type O are considered the universal donor and can donate to a recipient with any blood type. Donors with blood type A can donate to recipients with blood type A or AB. Donors with blood type B can donate to recipients with blood type B or AB. Donors with blood type AB can only donate to recipients who also have blood type AB. Most of the time, when people find out their blood type, they also get a positive or negative at the end, which is the Rh type. This marker is found on red blood cells, but not on kidney cells. For this reason, the Rh type does not matter for kidney donation. The second major item we consider when determining if a potential donor is compatible with their intended recipient is to see if the recipient has HLA antibodies against the donor. HLA stands for human leukocyte antigens. These are the markers on the outside of everyone's cells that tells the body which cells are their own and shouldn't be attacked versus foreign cells like a bacteria or virus that should be attacked. Many recipients do not have any HLA antibodies. The usual way that patients develop these antibodies are through prior transplants, pregnancies, blood transfusions, or on very rare occasions, infections. Both donors and recipients undergo blood testing and sometimes cheek swab testing to determine if they are compatible. This blood testing are often repeated at specific time points leading up to the transplant to make sure the recipient remains compatible until the time of surgery. If the recipient and donor are found to be incompatible, either due to blood type or donor-specific antibodies, the donor and recipient can be entered into the Kidney Paired Donation Program, otherwise known as KPD. In this situation, the donor would donate to a compatible recipient, and the recipient at Mass General would receive a kidney from a compatible live donor as part of a swap. The picture here illustrates a typical paired exchange swap. There is a separate video available that provides more information about the KPD process.